Okay guys, so today is November 10th, 2017, on a Friday. I gave birth November 4th at 11:01 p.m. My daughter's name is Sabrina. She was 6 pounds 1 ounce, 19 inches long. Only pushed for about 30 minutes. So she came out. She wasn't crying right away. I think one of the pushes that I did, I kind of like cut her off right here for a while, and I didn't get another contraction for a while, so she wasn't breathing right away, and they wouldn't clean her up, I guess, cleaned out her nose or whatever, and then she was breathing. They had her on me the whole time. They were sewing me up, and healthy baby. From that Saturday, she didn't poop. That Sunday, she didn't poop. Monday, it wasn't until maybe like almost 7 o'clock, 8 o'clock, she finally pooped. But she also wasn't having as many wet diapers either. So I was only breastfeeding. So I didn't think that I was giving her enough. And nobody actually came around and was like, oh, let me see how you're breastfeeding. I mean, they had a class where they just taught us pretty much how breastfeeding is the best thing for them. Nobody came around and was like, oh, this is how you should use the breast pump, because I was using it and nothing was coming out. Nobody told me that with the size of my breast that I should like push the cup against my breast. Like my boyfriend had to suggest that to me so that I can see that milk was coming out. So when I got discharged, before I got discharged, my nose actually started bleeding. And I told the doctor about it, and she said it was not a big deal. They checked my blood pressure. Mind you, I told you guys before, during my whole pregnancy, me being diagnosed with preeclampsia, my blood pressures were normal, like as if I didn't have it. It was very mild. It was so mild to the point where right now I should be pregnant, 38 weeks pregnant, okay? I should have another 2 weeks to be having my baby. So my diabetes, the gestational diabetes, is what was fucking me over pretty much. And after I gave birth, I didn't have the diabetes anymore. But they weren't even monitoring my preeclampsia or my blood pressure, because if my blood pressure was 144, and the only time it's ever been like that was when I was 31 weeks pregnant and I got admitted for the 12 days, that should have been a red flag for you guys. You know what I'm saying? And they didn't even check on me about that. They was like, your baby pooped, you can go. When I got dressed so we can leave, my legs started to swell. My foot was swollen. Mind you, the whole pregnancy, the whole time I was in the hospital, oh, your leg's swollen, blurry vision, this, and this. Nothing. But now that we being discharged and after I had the baby, my nose bled, had 144 blood pressure, and my legs were swollen. So they said that they were going to give me Tylenol for pain because I had a vaginal delivery, and they were like that they didn't really want to give me Motrin, the ibuprofen, because it had a lot of sodium in it. So they said that they should give me the Tylenol, but then they said, no, it's okay, we're going to give you the ibuprofen, 800 milligrams. So that Tuesday I took it twice, and then Wednesday I took the Tylenol. I wasn't feeling right. I wasn't feeling like myself. In the hospital, I didn't have her in the nursery at all. I just didn't trust it. You know, finally seeing my baby, I wanted to have her around me and do everything I needed to do for her. So I kept her with me. She slept in the bassinet one time, and then the rest of the time she would only sleep on me or by her father holding her. She wouldn't sleep in there, and it was frustrating. I didn't get any sleep. I didn't ask anybody for help either. So when we got home, she didn't want to sleep in her bed. She didn't want to be in the mama swing thing. She didn't want to be in that. She was just unhappy. We ended up having to like lay down in the bed with her, and you're not supposed to co-sleep because they think you're gonna roll over on them. And I just wasn't getting any sleep because I was watching her the whole time. Meanwhile, I'm having these weird sensations in my chest, my throat, It feels like my heart's in my throat. And I'm checking my blood pressure, and it's like 150, 160. So then I was just monitoring it, and it went down to 140. Then me and Devin went out to try to buy the bassinet that you put in the bed. And to make a long story short, we went there for nothing. By the time we came back home, I was feeling weird, like just like a weird sensation. I didn't really have a headache, but I had like this weird sensation, like my heart was in my throat. You know, I was very emotional. Like I felt like I was gonna die or something. I checked my blood pressure; it was 160. Then my ceiling started leaking again. And I'm like, all right, so I'm going to wait for the super to come up and try to fix it, and then, you know, we can leave. He checked it out and was like, oh, I'm going to be back at like 8 o'clock or 9 o'clock or something like that. He's going to go upstairs and check the neighbor, which we think they moved out. And I checked my blood pressure again, it was 170. I was like, nah, I'm not waiting. Let's go. Got in the cab, took the baby and everything, and got to the emergency room. They checked me. My blood pressure was 180 over 109. And they started giving me some kind of blood pressure medication through an IV. And then they told me they was going to take me back upstairs to labor and delivery because they felt like during the pregnancy, my preeclampsia was giving me normal numbers, and I had the diabetes. But after I gave birth, the diabetes went away, but my preeclampsia spiked. So they said that sometimes can happen after you give birth. Like giving birth doesn't automatically make it go away. And I have read somewhere that a lot of times when people have C-sections, they monitor them closely because that can happen. But for some reason, if you have a vaginal birth, they make it seem like everything is okay and these things can't happen to you, which is untrue because obviously that's what I'm suffering from right now. And they told me that I couldn't take the baby upstairs because she wasn't a patient anymore. And I got like hysterical. I freaked out. And I freaked Devin out so bad. And it's like, you know, I'm a new mom and everything. And I just, you know, I didn't want to be away from my baby. You know, especially me trying to breastfeed. And it was horrible. And then where they put me at, they put me in recovery. So recovery is pretty much where all the women who got C-sections is coming in and their babies is there. And I'm hearing babies and I'm seeing people go into the operating room to have the C-sections. I'm hearing women in labor. It was torturous. And it's like they want me to be calm so they can check my blood pressures. How? I'm emotionally stressed, you know? Like, how am I supposed to calm down so you can get good readings? But they eventually moved me to the room where I actually started my labor, where they put the Cytotec pill in me. And then they moved me. People coming in and out. They brought me upstairs. I'm pretty much 2 rooms down from when I was staying here for the 12 days to monitor me. They didn't want to let me keep the baby here once again, but then they said if somebody's here with me, then I can keep the baby because they don't want to watch the baby because we're not on a lockdown floor, and because you don't have a wristband. Like if somebody was to come in the room and there's a taker, they wouldn't even know about it. So that was their concern, but whatever. So pretty much they gave me some medicine. What is this? What is it called?
Nifedipine.
It's called nifedipine. I have to take 1 pill twice a day, every 12 hours. So they said if my blood pressure is 120 over 70, that I can't take it. Anything over that to take it. I'm going to double ask because I'm like, what if it's 120 over 75? Do I still take it? But other than that, everything's good. I'm going to give you guys a glimpse of her on the bassinet. And we should be leaving very soon. I'm ready to get out of here and go home and enjoy being a mom. This is Devin.
Yo.
And I will see you guys on the next vlog.